The purpose of this video is to instruct caregivers on how to perform a Hoyer lift transfer. At Corewell Health, we have two kinds of Hoyer lifts. Ceiling lifts are permanently built into the ceilings of certain patient rooms. These move on a sliding track. Because there is no base to slide under the patient's bed, this allows the greatest maneuverability. If using a ceiling lift, please make sure to raise it all the way and return it to its charging station when finished. There is also an emergency pull cord on ceiling lifts. Floor Hoyer lifts are often used in gym spaces or to move patients outside of their hospital room. They are also used in hospital rooms that don't have ceiling lifts built in. These have large rechargeable batteries. Spare batteries are kept on chargers in equipment storage rooms. If using a floor Hoyer lift, you will need to be mindful of the legs at the base of the machine. A lever on the front of the machine or a button on the controller of other machines will widen or narrow the distance between the legs, making it easier to slide them under a bed or around a chair. While ceiling lift slings have cloth loops which attach to 2 points of contact on a T-shaped bar, floor Hoyer lift slings have plastic attachments which snap around 4 points of contact. The controller for floor Hoyer lifts also have buttons which allow the therapist to adjust how upright or reclined the patient is during the transfer. If there are no floor Hoyer lift slings available, the lift adapter can be removed and changed to a T-piece adapter. Familiarize yourself with where this is kept in your facility. Disposable slings should have an orange tag removed and given to the nurse to charge the patient. Some slings have flexible plastic stays slid in them for extra support. You can remove plastic stays in the sling for improved comfort if the patient is going to keep the sling beneath them when up in the chair. Special precautions. If the patient has an acute amputation, the rigid removable dressing should remain on during Hoyer lift transfers to protect the residual limb. If the patient has hip flexion precautions, check with the physician orders to clarify. There have been patients with a history of hip dislocations after total hip arthroplasties that have orders not to use Hoyer slings at all. If the patient is incontinent, place a blue incontinence pad between the patient and the sling when able to. If the patient has a sacral ulcer, do not use the Hoyer sling on bare skin, as this may rub against the wound. Bed to chair transfer. Explain the procedure to the patient and make sure that they verbalize agreement. Select a sling that is the right size for the patient. Our clean utility rooms supply Hoyer slings in small, medium, and large sizes. Be sure to get the appropriate sling for a ceiling lift versus a floor lift. Line the recliner chair, commode, or wheelchair up so that it is close to the bed. Keep the rest of the area clear of clutter. Flatten the bed to make it easier for your patient to roll. Bend the patient's knees up and stabilize them. Have the patient roll to one side, assisting at the shoulders and knees. If they are able to help, have them hang on to the rail. Roll half of the Hoyer sling up, starting with the edge that will be farthest from you. Place the Hoyer sling under the patient, lining the unrolled edge with the outside of the patient's shoulder and hip closest to you. Make sure that the handle loops are on the underside of the sling. Next, have the patient roll to their other side, over the rolled portion of the sling. Unroll the remainder of the Hoyer sling from the opposite side of the patient. Now have the patient roll onto their back. The Hoyer sling should now be placed evenly under the patient. Crisscross the bottom straps underneath the patient's legs. Position the Hoyer lift over the patient. Cue the patient to cross their arms over their chest. Verbally instruct them to resist the urge to hold onto the bar during the transfer. Hook the loops of the four corners to the hooks of the Hoyer lift. When using the ceiling lift with adjustable straps, if you select the shortest loops for the ones closest to the patient's shoulders and the longest loops for the ones closest to the patient's legs, this will help the patient to obtain the most upright position. Press the up button on the Hoyer control. When the machine is in the most raised position, one helper can use the handles on the Hoyer pad to move the patient to the chair. The other person can help to stabilize the wheelchair or commode to ensure that it doesn't slide. If transferring a patient to a recliner chair or wheelchair, make sure that the brakes are on to ensure that it does not roll. Lower the patient to the chair or commode using the button on the Hoyer controller. The second helper should guide the patient so that their bottom lines up to the chair as far back as possible to encourage an upright posture. They should also support the patient's head if necessary to keep the bar from hitting the patient's head as it lowers down. To remove the Hoyer sling from underneath the patient, uncross the leg straps. Have the patient bend forward at the waist and or shift side to side. Then pull the sling out. If the patient is comfortable with the sling underneath them, you may leave it under the patient for the nursing staff to use when they transfer the patient back to bed. Bed to chair modified. If a patient is unable to lay flat due to breathing problems or other precautions, there is another way to get the Hoyer sling underneath them. One helper will instruct the patient to lean forward, supporting or assisting them as necessary. The other helper will place the Hoyer sling between the patient's back and the bed, sliding it down as far as possible and tucking the edge under the patient's hips. Next, have the patient lean back. Now, bend the patient's knees up and slide the straps of the Hoyer sling underneath the patient's thighs. You may need to tuck the edges of these underneath the patient's hips or pull on them to achieve proper alignment. Crisscross the straps, then proceed with the rest of the transfer. Chair to bed transfers. Explain the procedure to the patient and make sure that they verbalize agreement. Have the patient lean forward in the chair. Have a second person assist if the patient lacks trunk control. Tuck the Hoyer sling under the patient's hips. Make sure that it is right side up and handles are face down. Line the top of the Hoyer sling up with the patient's shoulders. Have the patient weight shift to one side. Assist as needed. Lift the patient's leg to place one strap underneath it. Lift the patient's other leg to place the other strap. Next, slide the ceiling lift along its track and position it directly over the patient. Lower it down until it is at a height where the loops of the sling can easily be attached to the hooks. Hook all 4 loops. If the patient is going to be sitting up in bed, using shorter loops up top and longer ones at the bottom will help you obtain a more upright posture. Whereas if the patient will be laying flatter, using longer loops at the top will help you obtain a more reclined posture. One helper should now push the up button on the controller of the lift to get the patient out of the chair. The other helper should support the patient so they don't sway too much as they ascend. Once lifted, both helpers can move the patient towards the bed, supporting the feet and guiding the sling using the handles on the outside of it as necessary. It is helpful for the second person to move to the opposite side of the bed to give the best leverage to use the handles on the outside of the Hoyer sling. When the patient is over the bed, you can use the down button on the controller to lower the patient back to bed. The second helper can support the patient's head or any weak limbs to ensure that they are comfortable as they are being lowered back down. Lower until there is slack on all 4 loops of the Hoyer sling. Clip the controller to the bar so it doesn't sway as you unhook all 4 loops. Once the patient is back in bed, uncross the straps from between their legs. Bend the patient's legs up. Have the patient roll to one side, assisting at the shoulders and knees. If the patient is able to grasp, have them use the bed rail to help. Roll the Hoyer sling up, tucking it under the patient's torso. Next, have the patient roll to the opposite side, again assisting at the shoulders and knees. Pull the sling out from under the patient. Have the patient roll back to the center. Use the bed controls to raise the knees of the bed before raising the head of the bed to make the patient as comfortable as possible before you leave.